But thank you, McCall. So I think I may have spoke to some of you before, but my name is Margaret Beardsworth, and I manage our insurance program here at PHA. And obviously one of a huge goal of our insurance program is to really provide as much and as many interactive tools for the PH community as possible, and tools that really help folks not only understand but navigate and advocate within the insurance system. So today we're really excited because this is a new educational front for us in really addressing specifically insurance concerns and needs of parents and their children with PH. So like McCall was saying, this is a very, we want this to be very conversational. So please, at any point, if you want to jump in and you have a question or you'd like to make a comment, please do, because this is a learning experience for us as well, and we're definitely listening to your comments and your ideas. So we do have an information-packed webinar. We're really excited. We have Caring Voice Coalition, which many of you may have worked with in the past, and they provide free insurance and disability assistance for folks with PH, as well as they also have a financial assistance program to help folks with their out-of-pocket costs. So we're really excited to have them on the phone, and they're going to talk. They're going to give a really informational-packed presentation about the different sort of obtaining insurance, the different types of insurance available, and then outline some of the eligibility standards for the different types. And then we are also really excited because we have Lois Waltag on the phone, and she's going to talk a little bit about her personal experience navigating the insurance system. And she's also a parent of her child has PH as well. And then of course after that there's going to be time for questions and discussions, but again at any point if you have a comment, feel free to jump in. And so I will go ahead and introduce our two speakers from Caring Voice Coalition. We're really lucky to have Miranda James, who is an attorney at Caring Voice Coalition, and she manages the Disability Assistance Program, as well as a team that focuses on specialized insurance system assistance and guidance. And then we also have Amy Jackson on the line, and she is the Insurance Education and Counseling Team Coordinator at Caring Voice Coalition. And she coordinates the patient services offered by the IEC team, including helping patients find insurance options and providing assistance and management for COBRA enrollment. So Miranda and Amy, thank you guys so much for being on the call, and I will go ahead and pass the reins over to you.
Thank you, and we're happy to be here today. Hopefully we can provide some information that's going to make a difficult process a little bit easier for each of you. And so let us begin. Okay, I just give you a little bit information of what to expect today. As I'm sure you all are aware, finding insurance for individuals or for your children who are inflicted with pulmonary hypertension, what we're going to go over today are some different options that may be available to each of you. And first of all, we just want to go over, just give a brief overview of what the Caring Voice Coalition does and what we're about. And then we're going to touch base on group coverage issues and COBRA, options involving individual plans and governmental programs, and also touch base upon pre-existing condition plans, high-risk pools, and also have a link to helpful resources that can provide a little bit more information on things that we might have not touched on. We know our time is a little bit limited, and these areas are so vast that it's not possible to touch base on every single thing, but hopefully we're able to provide you with some information that can lead you to the next step in helping you locate insurance. And just to give you a little heads up, Amy and I are both going to bounce back and forth between speaking, so don't be surprised if you hear different voices. She's going to fill in where I might not have given information and vice versa. Okay. So the Caring Voice Coalition, if you're not familiar with us, our insurance and education counseling, our main mission is dedicated to helping individuals and families affected by serious chronic illnesses such as pulmonary hypertension. And we offer outreach and support that directly benefits that patient community. And with us being a disease-specific organization, we do have a lot of resources, and we are quite familiar in dealing with pulmonary hypertension patients. And so that allows us to give, informed information about the particular insurance plans that that pulmonary hypertension patients could be available for them. And specifically, why the Caring Voice Coalition Insurance Education and Counseling Program exists is because we understand that adequate health insurance coverage is essential for persons with chronic illnesses, and we also know that for those with health insurance coverage issues, it can be a complex and difficult issue to resolve. So we created this program in hopes of alleviating those problems for that population. And so just jumping right into things, the first thing we can touch upon is just the group or commercial coverage. And with that, that you're probably most familiar with that type of coverage for your children because you may be insured and therefore your children are insured under you. And as you probably know too, it's been extended to age 26. Sammy, you want to fill in a little bit of information about that?
Yeah, under the new health care reform, of course, children can be covered as a dependent through their parents' policy until their 26th birthday. I'll get into under another topic a little bit more, but the HIPAA laws really apply with the group sponsor coverage, and so I'll get into a little bit more of that. But your children are quite often protected under HIPAA laws, and unfortunately a lot of people don't realize what those laws entail. And if you don't realize those time periods pass, and so I'll get into that a little bit more. But of course group sponsor coverage is the first thing. If you have it available through your job, then that's, you're going to carry your children as a dependent.
And before we move on to COBRA, I'm just wondering if anybody, I meant to put a situation in there for any questions about group coverage that you may have. So feel free to jump in and ask questions at a time where where it pops up or you think of something, okay? Okay.
The next topic we have listed here is COBRA coverage. COBRA coverage is just an extension of the group coverage that you may have had your child covered under. And so under COBRA coverage, the child can extend the benefits if group coverage has to end. COBRA coverage is very detailed, so I won't get into too much information about it right now. But it is coverage that will help your child to continue their benefits under the group plan should you or your spouse or the parent of the child, other parent of the child lose their group sponsor benefits.
And it's also important to note too that I don't know how aware you are of COBRA, but it can be quite expensive at times. So if you're not able to continue coverage for yourself or the other parent or the other child's parent, then the coverage can continue for the child alone.
Yes, and under the COBRA coverage too, and if it's something, because COBRA premiums are very expensive, so a lot of people choose not to elect this coverage because they can't. And so that would be an area where you could contact our organization to determine if you're eligible to apply for our premium assistance program. So that would be a possible avenue should you not be able to continue yourself or the child's parent other parent under COBRA coverage, but want your child to continue on to get that 18 months, then that would be an option for you. COBRA like I said, it can be real detailed, but there are COBRA laws, and so you should be, aware of those laws. And for companies that have less than 20 employees, there are many COBRA laws. So again, it's a very detailed topic. I can answer specific questions about it, but you can also contact our organization too regarding any of these issues, and someone in our insurance education and counseling department will be more than happy to answer your more detailed and specific questions at any given time. So.
just got a question from Alex in regards to has the law extending the coverage till the age of 26, has that been passed and is it in effect right now? And yes, it is in effect right now.
Thank you.
You're welcome.
Yeah, just going on more about COBRA coverage, the qualifying events for your dependent children would be the dependent child status under the plan rules. So this would also COBRA would be available later on. I know that, most of you, we're talking about children under 18, but at the end of our slide, we're doing a little brief information about transitional coverage. So for those individuals that when they turn 26, and they have to come off that plan, that COBRA would be available to them. So, but they are right there a list of other qualified events that would allow your child to continue under COBRA, continuation of coverage. Again, I mentioned mini COBRA because if you work for a small company and you have less than 20 employees, the company has less than 20 employees, and you lose that employment, that job is not entitled to provide you COBRA coverage. However, mini COBRA many COBRA laws do apply. However, they're state-specific, so you would need to, and I think that's one of the links we did provide to you at the end of we're providing to you at the end of this presentation, but many COBRA laws vary from state to state. But that, helps protect those individuals who don't have the option of continuing COBRA benefits because of the company having less than 20 employees.
And it's just something else I want to reiterate. If any of this is confusing or, you definitely need a little bit more information, we are more than happy to assist you. If you can just get in touch with the Caring Voice Coalition and their insurance and education counseling program, we'd be more than happy to help you because I know each person's situation is a little bit different. Each person's, requirements required, different attention. So just feel free if you need a little bit more information. We're just trying to go over it broadly and provide you with as much information as possible without inundating you with information.
Just brief information on COBRA and convertible coverage. Just if your group coverage offers their participants, if the plan offers their participants the option of transitioning into an individual plan when the group coverage ends, they have to also do that for COBRA members as well. So if you if you have a child that's covered under COBRA for 18 months and they exhaust that 18 months and the plan offers a transitional coverage for its members for an individual plan, they'd have to do that for you as the COBRA ends as well. And again, if you have any questions, please let us know. We have a lot of information, so we're moving through kind of quickly, but we want to be sure that we're addressing everybody's concerns.
And if anybody has any personal experiences in dealing with COBRA, whether it be positive or negative, certainly feel free to share.
No, I never heard of them at all.
Of COBRA plans?
Yes, never.
Oh, okay.
I never heard of them.
Okay. If you need some more information, or if you think it's something that might apply to your situation, then certainly feel free, and we'd be more than happy. Even if it doesn't apply and you just want information about COBRA because it might apply in the future, you can get in touch with us, and we'll be more than happy to share that information.
Now, say if Shannon gets a job part-time, and she wants to be an X-ray tech when she graduates high school, which is in 2 years. Does she if she works 10 hours a week? Does she lose her benefits? Do you know anything about that?
Is she offered coverage through that job? Is that what you're asking?
Right, well, right now Shannon's on Mass Health as well as Blue Cross.
Is your daughter on disability?
No, she doesn't collect disability at all.
Oh, okay.
So you're asking because if she works 10 hours, will she lose her coverage benefit?
Yes.
No.
No?
No, because coverage is not based on income whatsoever.
No, because Mass Health always told us Shannon's not allowed to have more than $1,500 in the bank.
Oh, okay.
It's a public program that she went through with the state.
Yeah.
What did you say the name of it was?
It's Mass Health.
Okay. I know what you're talking about. If you would, I think for you that question can get rather detailed. So if you wouldn't mind giving me a call and we could discuss that further and how she could address that and avoid losing those benefits.
Okay.
Okay?
Yes.
We currently have COBRA.
Okay.
This is Jane.
Hi, Jane.
Hey. Amy knows me.
I do.
Yes, we do have COBRA, but we will lose COBRA November 1st. We'll be without insurance. And I have no complaints about COBRA at all. I think it's been fine.
Great. And it's also important to note, too, and I can touch base on this a little bit further when we talk about some disability issues, but if an individual is on COBRA and they are determined disabled, they can get their COBRA extended an extra 11 months. It's just you need to notify the COBRA administrator within 60 days of your determination date. And so there's ways to extend it to cover the period of time. But, you know, with the children we're talking about, most likely they're going to be on SSI where they'd get Medicaid immediately anyway, so that COBRA extension is not necessarily like as important as, you know, an adult who is on SSDI. So I don't want to confuse by throwing in, you know, different terminologies and such. But COBRA definitely is, you know, is a good program for medical coverage to continue on. And unfortunately, you know, our organization here is available to offer financial assistance because we do know it gets costly, and that's a big reason why people sometimes choose not to elect COBRA.
Well, there is a government program, or there was when we got COBRA, and we've had COBRA since last May or something like that. I don't know, whenever the 15 months started, and we were able to get government program, and they pay 65% of our premium.
Nice. That's good.
That sounds like the ARRA subsidy.
It was some government thing, and we had to qualify for it, and we did fortunately qualify for it, so it knocked our premiums down 65%. I think it was 65%.
Yeah, that was the ARRA subsidy. Unfortunately, it's no longer available. Like for people that are just joining COBRA, it's no longer available for them. But however, you know, that's another thing. Just reiterating to you all that's why we're here. You know, it's very possible that we could help. You know, if your children qualify and you need assistance with that premium, or if your family qualifies, then we would be able to possibly provide premium assistance to help with that COBRA premium payment so they can continue that coverage. So, you know, never hesitate to call, and we can talk to you about that. So.
And there's a question from Alex, too. Is it better to apply for Social Security disability after the child reaches the age 18 or keep them on private insurance? Now, that's certainly a personal situation. It's all dependent on what's best for each individual person. But if you're on private insurance, it's always good to stay on that. But there's different reasons for applying for disability before the age of 22, and that's in regards to being able to recover benefits from your parents. If you're not determined disabled before the age of 22, then the benefits that you're going to be able to recover throughout your life are going to be a lot smaller because your work history, you won't have a work history to earn off of. But if you already have private insurance, then there's, you know, and your child, if your child's disabled, certainly go ahead and apply for disability and go through there. And that doesn't mean you'll lose your private insurance that you have for your child. You just have, you know, Medicaid available to you as well. Does that answer your question? Alex?
Thank you.
Okay, thank you.
All right. Moving right along, securing independent coverage through an individual plan. Securing individual coverage is a little more difficult, and I know that for most of you all, this probably would come into effect when your children no longer have group coverage available to them through their parents, through you all, or through the COBRA coverage, and that's all been exhausted, so their only option is to transition into an individual plan. So they're a little more difficult. Under the individual plan coverage, though, you're protected under HIPAA law, and HIPAA law is also very detailed. There's a lot of information that's involved with that, but I kind of wanted to touch upon HIPAA law a little bit because I think a lot of people aren't aware of all of the information that is available in the HIPAA law, and that it protects you and your children. It protects your children, specifically this community, because they are diagnosed with a chronic illness. So HIPAA law is the Health Insurance Portability and Accountability Act, and I think when people hear HIPAA, all they think about is the privacy and security of your protected health information. But HIPAA law also protects individuals from being discriminated against because of a pre-existing condition. So there's a lot of information under HIPAA law, and if you're transitioning to an individual plan, the HIPAA law also applies to you, as well as the group coverage. And so, for an example, in explaining the HIPAA law, if you are working at a job and your child is covered at that job, and you lose that job, and you're unemployed, you're a single parent, for example, you're unemployed for 6 months, and you go to get another job, your concern is, are they going to take my child with this pre-existing condition? Under HIPAA law, they have to take your child. I mean, you're an employee, coverage is offered to you. It has to be offered to your dependents. The issue comes in is, will they be subject to the pre-existing exclusion period? So that's when we can get into detail. So if you have specific questions about that, but there are HIPAA laws that will protect your child, and that will, even if they are subjected to a pre-existing waiting period, there are a whole lot of conditions that would help offset that waiting period that you may be eligible for. So that's something that's very important, and it also, again, applies to individual plans when you no longer have group coverage available to your child. State laws I do want to mention, because when you're buying individual health insurance, this statement says that HIPAA eligibility gives you greater protections than you would otherwise have under state law. But however, the HIPAA law, the state laws are complemented by HIPAA. So you can even, if you, as a HIPAA individual, you can also get additional protection through the state laws if you already meet the HIPAA criteria. So again, that's a lot of information. So if there are any questions specifically about individual plans, the HIPAA law, please feel free to let us know. Okay. The next thing we want to talk about is government programs, and as the young lady spoke that talked about MassHealth, I think that MassHealth would fall under the government programs, but there are numerous types of government programs. The first one, of course, we have is Medicaid. The thing about Medicaid is that most people think they associate Medicaid with someone that's, extremely, living in poverty, and a lot of people think, I won't qualify. The problem is not even so much with the income. The problem is that Medicaid is available to individuals who are age blind or disabled, or it's eligible to individuals who are under 18 but who meet certain, and whose family household meet certain income requirements. So in a lot of situations, Medicaid is not an option because, parents work and you have this child and your income's over for a Medicaid program. However, that's when the disability comes in. If your child is suffering with this illness and it's disabling them, and you determine that you're going to apply for disability for them, again, Miranda will be explaining more about SSI, but if they are approved, then they would automatically get Medicaid. So other than them being declared disabled, you don't meet the criteria for Medicaid because you have to be, again, age blind or disabled, or you're a child who's living in poverty. So I'll let Miranda go into more about the SSI.
Okay. As many of you might know, once you're determined disabled, if a child becomes disabled through Social Security under SSI, then they automatically become Medicaid eligible. However, a problem does present itself, too, when applying for SSI for your children because they do deem some of the parents' income, the household income, as part of the income for the child. So there are income limitations that have to be met in order for your child to be determined or to be eligible to apply. But with that being said, for purposes of Social Security, a child is considered a person who is neither married, as determined by Social Security, nor head of household, and who is under 18 or under age 22 and is a student who regularly attends school. And also in regards to the eligibility requirement, their standards are different than they are for adults. A child may be eligible for SSI from birth until the age of 18 or, again, as I said, 22 and still attending school. And they evaluate, once a child turns 18, obviously they're no longer considered a child, and Social Security reevaluates their disability as an adult status. So as a child, the criteria for determining disability is different than it is for an adult. It's a little bit easier to be determined disabled as a child. However, the roadblocks that come into play a lot of times is the income limits that they set for parents. And I do have a quick question here. Can you quickly just say what SSI stands for and clarify that it's administered through the SSA? Absolutely. So SSI is Supplemental Security Income, and what that is, it is also administered through the Social Security Administration, and it's a state-run program. That's why Medicaid comes into play. Social Security has two different ways of determining or paying out benefits for disability, one of which is supplemental security income, and the other is Social Security disability insurance. Now, children don't typically apply, Social Security disability insurance doesn't typically apply to children simply because they haven't worked. And that's what supplemental or Social Security disability insurance is for, those individuals who have worked and paid into Social Security. So their limits or their benefits are typically higher if you've worked into the system. And I know I had previously stated it's important to, or if you can, to get your child determined disabled prior to the age of 22, simply because if that's done so, then they can earn their benefits off their parents' income, one of their parents' incomes, or the work that they put into Social Security. So once they hit 22, then they can start earning, or their benefits can be a lot higher. And as we all know, that's definitely important, especially when dealing with, someone who has pulmonary hypertension. And Social Security and SSI is a huge, huge area, and I could probably spend a few hours talking about it. So if there are any, specific questions or any, individualized situations, if you want to touch base with me, give me a call. I'd be more than happy to go through any options, discuss your child's situation, and whether or not I think that they would be good candidates to apply for SSI. And also, as I stated before, the good benefit of SSI is the fact that you immediately become eligible for Medicaid, again, which is very important for individuals suffering with pulmonary hypertension. But also, it's important to note that even though that, I said they reevaluate this, the child's disability determination upon reaching the age of 18, they then classify them as an adult, and they're under those standards. So sometimes you may have a situation where a child has been receiving benefits, but upon redetermination, they decide that they're no longer disabled. So those are things that you have to take into consideration too. Does anyone have any questions specifically relating to SSI or Social Security?
I'm sorry, this is Alex Salama. I was wondering, could you broadly define how does Social Security define disability for pulmonary hypertension? Are there general criteria?
Sure. Actually, Social Security doesn't necessarily define disability for specifically pulmonary hypertension. They just have a broad definition for what they determine is disability. And what I can tell you that is basically their criteria is you have to have a condition that has lasted or expected to last for a continuous period of at least 12 months or expected to result in death, which that, probably doesn't give you that much information. But for a child, basically what their criteria is whether they're significantly impaired in a sense of having difficulties with, problems going to school, problems doing household chores, problems getting, their daily activities, those types of things. Now, when you get into adulthood, that criteria changes, and it's an inability to perform substantial gainful activity, and that's in a sense of, not being able to sustain work on, 8 hours a day, 40 hours a week type of thing. And it's based upon your symptoms, and you have to have the medical documentation to back up your symptoms. And that's something that I can't stress enough. And if anybody is thinking about applying for disability, I highly, highly recommend touching base with your physicians. I'm imagining that you have a fairly good relationship with them simply because of, the illness you have to, you're most likely at the doctor's office on a regular basis. Establish that record of, medical documentation just so you have it to support and you can keep it together so when the time does come to apply for disability, you're well prepared, you know where you stand, you know what your symptoms are, you know the test results, and it's supported by the medical documentation.
And just one follow-up question.
Sure.
Do you happen to know because you said some of the obstacles is the parent's income,
right.
Do you happen to know what are those limits?
I do have those limits. It depends on the parents in the household. It depends on how many children are in the household. And if you want, you can give me a call because it's a list. It varies from situation to situation. And so I have that, and I would be more than happy to share your particular situation with you personally if you'd like.
Okay.
Okay.
Thank you.
And I have no problem. And there's another question here. My son just turned 18 and has some money he saved in his bank account. Would that make him ineligible for SSA or SSI? He's unable to perform normal everyday duties, is on the transplant list, and has PH. Depends on if he just turned 18. It depends on how much money he has in the bank, and there's always, ways around that. He can certainly put that money in, someone else's name, that type of situation to get around the income and /asset limitations that Social Security has set forth. So that's certainly something I think that can be overcome if, but that's in regards to, having trusting sources and that type of thing, just to make sure that those, that money is protected on his behalf. Are there any other questions in that sense? And if something else pops up once we leave here today or a couple days from now, again, you'll have our contact information, and you can certainly touch base with us.
Well, moving on, and I'll move through these next topics, quickly to give our parents speaker time to talk, and also, so if you have any questions. So I'll move through these, rather quickly. But again, please type in any questions, or feel free to call us, or you can interrupt me if you have a question. But so the CHIP programs, which I'm thinking is what the young lady spoke when she said Mass Health. I'm thinking that falls under the CHIP, which is Children's Health Insurance Program. It is programs that are set up through states. Not all states have these, but through some states. And it is for those individuals that are struggling with income, but so they don't meet the requirements for state Medicaid, and so they may meet the requirements for the CHIP program. They have broad flexibility income eligibility levels, but most states cover children up to 200%, so up to the age of 18. But CHIP coverage is really good. It's really good coverage. It's unlike Medicaid. You don't have to be declared disabled to apply, and if your family income is of course over for Medicaid, then it's very likely they'll qualify for the CHIP program.
And if I could just step in on that, oftentimes they're supposed to have, when you apply for Medicaid, they're supposed to also screen you for eligibility for CHIP. Now, as you might know of, dealing through various programs that you may or may not have dealt with, that sometimes those situations don't always happen as they're supposed to happen. So it's very important to stay on top of things. And as I'm sure you've heard a million times, you have to be your own advocate, and you have to stand up for yourself as much as possible and make sure things are followed through with. Otherwise, things can slip through the crack, and then you're obviously left standing there thinking something had been done when it hadn't. So if you've applied for Medicaid and there was a CHIP program available and it just wasn't, don't just assume that you didn't qualify for it. Follow up with it and make sure that had been done.
And just moving on through to just through CHIP again. It's state programs. Not all states have CHIP, and they're often referred to as S-CHIPs. State Children's Health Insurance Program. So, again, we're going to move on through to try to move this along. But if you have any questions specifically about CHIP, or again, please feel free to give us a call. Moving on to our pre-existing condition insurance plan. The pre-existing condition insurance plans were set in place when the health care reform took place, and they are available now. And it's supposed to be available until the 2014 part of the health care reform takes effect, where pre-existing conditions will be eliminated. But right now, pre-existing condition plans are available in every state. You have to be uninsured for 6 months to qualify for the pre-existing condition insurance plans, but that's basically the only criteria. Is you have to have a pre-existing condition, you have to be denied from an insurance company for having that condition, and you have to be uninsured for 6 months. That's basically it. The premiums are fairly reasonable, and they've recently dropped as of July 1st, and the coverage is comprehensive. It provides medical, hospital, doctors, as well as prescription benefits, and has fairly reasonable deductibles, co-pays, things like that. So, again, premiums vary from state, but they're very reasonable. It's just you just have to watch from each state, because some are state-run and some are run by the federal government. High-risk pools, I'll just briefly say that high-risk pools are available only in some states. They have criteria attached to them. Specifically, you have to have had insurance within 63 days. You cannot have a lapse in coverage longer than that. But there are expensive costs related to high-risk pools, in most cases higher than COBRA premium. So that's another option. And so I'll move on to our transitional period, which I'll just briefly say that in the transitional period, after your child turns their 26th birthday, age 26, there are numerous options. Again, I'll just reiterate, they're protected under, at that time, if they had group coverage, COBRA laws as well as HIPAA laws. So.
And of course, again, just to touch base again on just disability always being an option, and again, more than happy to discuss eligibility requirements, criteria, and just discussing, individually, my, I guess my professional opinion as to the, I guess the chances that, your child, would be approved for disability. And we've also added in here, and you can see throughout, and our last slide is not popping out. Oh, there it is. We've just added helpful links just in case that you wanted a little bit more information that we may not have touched upon with a limited time here. So these are good resources to go to that could provide you with a little bit more insight on some things. But also, please keep us in mind, we do understand that even though you have these helpful links and resources, they may be difficult to understand or, just comprehend because it is a massive amount of information. Fortunately, the Insurance Education Counseling Department understands these things in great detail, and we would be more than happy to share that information with you and explain it and go over it step by step, any areas that might cause confusion or just provide a little bit more detail in maybe more layman's terms. Okay. And, again, if you have any questions now, I know we have another speaker, so we're not trying to eat up all the time here. But, again, just keep us in mind, give us a call, and, feel free to email us, call us, whichever way is best for you to communicate. We're more than happy to help.
Miranda and
yes.
Amy, do you guys have, I know I sent out the phone number for CVC through the chat, but could you guys maybe state or send out via the chat your emails?
Sure, that's no problem.
Okay, thank you. Okay, so thank you, Miranda and Amy. That was excellent, and I know you went over lots of information really quickly, and we really and so appreciate it. And so now to sort of transition just a little bit, still in the realm of insurance, but to transition into more a personal story, we're also really lucky and excited to have Lois Waltag on the phone. And she is the mother. Her daughter has PH, and she's going to talk a little bit about her personal and the family's personal struggle with insurance and how they were able to successfully maintain the correct insurance coverage. So Lois, I'll go ahead and pass the reins over to you.
All right, thank you. So my daughter Amelia is 17, and she was diagnosed with PH at 4 and started on IV medication about 3.5 years ago. We have insurance through our employer, and since there are no pediatric PH specialists in our insurance network, we've always traveled out of state for our daughter's care. I'm going to get a little technical here with some insurance language and then get back to our story. Starting about 3 years ago, the insurance company had a special arrangement with our out-of-town hospital called a single case agreement. This means that the contracting departments from the insurance company and the hospital worked out the finances so our daughter's out-of-network visits were seen as an in-network visit. Well, last fall, when Amelia was 16, we were told that the newest employee insurance contract did not allow for any single case agreements. This meant that if we went to our daughter's specialist, we would have to pay out-of-network fees and be liable for everything above the usual and customary charges. And that would be financially out of our league completely. So we tried to work within the insurance company with our nurse care manager as our advocate. She said that the contract left no opening for a single case agreement. We talked with the state-level benefits manager, who told us there was no opening for a single case agreement. We talked with our local employer's benefit manager, who referred us to an insurance consultant who was contracted by our employer who might be able to help us with an appeal process. As we talked with each individual contact, we would say, our daughter has a chronic life-threatening illness. She must be seen by a PH specialist who understands the illness and has the skills to prescribe the right medicine and monitor her symptoms and side effects. Along the way, we got some suggestions that we thought were unacceptable. For example, we were told that in order to minimize fees, maybe we could have some testing done by an in-network cardiologist. We refused to do this because Amelia was once put on a treadmill by a non-PH specialist. She fainted, and it was a potentially very dangerous situation that we were not going to risk again. Another suggestion was to have Amelia start being seen by an adult specialist who would be in network. The thought was Amelia was 16 and a half, and she might as well start with an adult person. We felt strongly that our daughter needed to be in a pediatric program that understands the needs of teenagers, as well as being part of a program that works with the whole family. The insurance consultant helped us start the appeal process. He went over who to direct our appeal to, and he helped us with the wording of our appeals. We kept in touch with the insurance nurse care manager and state-level contacts as we started the process. And it was pretty ironic that each of these managers thought that the insurance consultant was not going to be helpful with our appeal. Well, it turned out that the consultant was the only local person whose job was to help guide us through the process. The first letter of appeal was a simple request asking for a continuation of the past contract. In response to our first level of appeal, the insurance company said they tried to create a single case agreement with the hospital, but it didn't work out. Then we knew that even though we were told the contract didn't allow for this kind of agreement, it was still something that could be negotiated. The next level of appeal was more involved. We summarized our daughter's medical history. We explained her current physical and psychological state. We argued two main points. She needed to be seen by a PH specialist, and she needed to be seen in a pediatric setting. Our PH specialist wrote a letter of support that we included. The response from insurance was that they tried again to get an agreement with the hospital, but it didn't work out. We were gearing up to go for the third appeal when we received word that a single case agreement had been reached and we could go to the specialist as an in-network provider. And that was really great news. We were really happy, and then we got even more good news. We were told that a multiple case agreement had been reached between our insurance provider and the large out-of-state regional children's hospital that Amelia goes to, so that any pediatric patient under our insurance plan would be able to receive services at the hospital at in-network rates. After such a long struggle, it felt really good to know that not only was Amelia going to benefit from an agreement, but that other kids were going to be able to get treatment without their parents having to go through an appeal process. So here's what we've learned after going through all of this. Just because insurance denies a first or second level of appeal, it doesn't mean that you might not eventually have a successful appeal. Also, it really helps to have an advocate or consultant who knows how the system works to help you with what to say and who to say it to. And finally, it's important to be patient. This process took us about 3.5 months. It was really discouraging and really exhausting. We spent a lot of time on phone calls, emails, meetings, and letters. But we knew that we were going to follow the process to the end, even if it meant going to the State Insurance Commission or contacting our representatives in Congress to try to get the best possible outcome for our daughter. And that's our story, with a happy ending.
Well done. I definitely like your point of sticking with it and pursuing things to the end. I think sometimes, when you're faced with a difficult challenge, it's easy to go ahead and give up. But I know it's just the words of encouragement to continue through, because we oftentimes deal with situations where patients want to give up, or you just don't see a light at the end of the tunnel. But everything is generally always worth pursuing. Because the worst it could be is that you're not going to get what you sought out, but you might. So that's always something that's important to stick it out.
I'd also like that. I think your story was awesome, and I'm, and really as a mother myself, I just could feel your mother's love of not taking no for an answer, and so I love that. But I always say, especially with insurance companies, that if you just accept what they say and you don't feel like it's right, they're not going to come back and say, oh, well, maybe we're wrong or maybe we'll work with you. So you do, I really like your point of getting an advocate, because insurance can be so detailed and complicated, and there's so many little pieces to it. And so when you have someone that is knowledgeable and can advocate for you, then you have a really good chance of beating whatever it is that you're trying to fight, because they're not going to just, in a lot of cases, they're not going to just give in. So thank you for sharing that. It was very beautiful.
Yeah, Lois, thank you. I agree completely. That was a wonderful story, and we really appreciate you sharing it. And at this point, I kind of want to just open the floor up to anyone that has a question or who wants to share their experience. And I see that Sunny has a question. So Sunny, if you want to go ahead and ask your question.
Well, it looks like she asked, what is an advocate and where do you find one? An advocate is just basically someone who is there to support and fight for, whatever it is that you're fighting for. They stand in your shoes. They stand in your shoes and support you throughout your fight is basically an easy way to put that. And where do you find one is basically along the same lines as Alex's question as well. How do you find an insurance advocate? And again, the Caring Voice Coalition, we certainly work as an advocate on behalf of our patients. We definitely can touch base with insurance companies and try to fight, maybe not every single claim, not every single issue that may arise, but we certainly will look into it, and we can certainly try to find resources that if we can't help you, find a resource that can help you. I know the Pulmonary Hypertension Association likely has tons of resources as well.
Sure. And Lois, do you want to talk a little bit about sort of reiterate how you sought out your advocate for Amelia?
Yes, because we initially tried within the insurance company because we had been assigned a nurse care manager, and apparently if you're a pretty involved patient with a lot of medical interventions, they pretty much automatically in our insurance company assigned us a nurse care manager who was on our side and who wanted to advocate for us but kept finding the doors closed because the feedback was the contract is so locked up that it wasn't going to work out. And honestly, we kept working the phones. We kept calling, our employer at different levels, whether it was the local benefits manager or the state manager, to see if anyone had suggestions for us. I think our next step was to go, to Caring Voices, to Pulmonary Hypertension Association. But I can say that by keeping it local, the person that we worked with, that we were guided to, who we didn't have to pay for, also had connections and understandings of our specific situation that I think were helpful and could tell us, why don't you copy this person or that person and, keep it within a local framework. If he wasn't available, then, of course, we'd have to seek something else out.
Okay, I see Jenny has her hand raised here. Jenny, you want to go ahead and ask your question?
Hi. I was just curious of what Caring Coalition would help with as far as we do have current insurance through my husband's work. And would they help with any out-of-pocket expense for my son's medical bills?
Typically what we provide financial assistance for is in regards to co-payments or premiums and for costs associated with, the expensive therapies or the premiums associated with your just insurance costs.
Okay, so I guess we had one of the founders and her daughter came to our support group meeting here in St. Louis, and I guess we were underneath the understanding that Caring Coalition helped with anything, and we just they would help with any prescriptions or anything medical bills.
Well, Well, we are a disease-specific organization, so your child being diagnosed with pulmonary hypertension, please call our organization. We are here to, we will look at his situation, see what the specific need is, and we will do everything we can to do to help him. I mean, looking at what we can do for him specifically, you know, we could talk to you one-on-one about that and see what his specific needs are, discuss your situation. But, yes, definitely he meets our criteria just because he's diagnosed with pulmonary hypertension. And what we can do at that point, you know, we definitely can discuss, you know, what type of assistance he qualifies for and provide him with as much advocacy as possible, as well as education and possible financial assistance. So we can definitely talk about that. So please feel free to call our toll-free number.
Okay, that sounds good. I did talk to someone there, and they kind of said that wasn't, because I asked them about, I guess, some co-insurance payment or some co-pays for my son's cardio cath that he just had done, and they said that we would not, you know, be eligible for that or wouldn't be able to provide assistance for that.
Okay. Well, yeah, you should definitely give us a call. Give our insurance education counseling department a call, and we can speak specifically just to see, you know, exactly what it is that you are looking for, just to see.
Okay.
And if we can't, then, you know, we do reach to outside sources to see what we can find in that sense as well. If we're not able to help, we do try to offer, you know, as much, I guess, a well-rounded support.
Okay, that sounds good. Okay, thank you.
No problem.
Okay. Are there any other questions, or does anyone want to share their personal experience with insurance or fighting an insurance battle? Okay. So I think that actually that brings us to about an hour, a little over an hour. So we'll go ahead and wrap up then. And I just want to reiterate that Caring Voice Coalition, their number is 1-888-267-1440. And you can call them with any questions. And also you can feel free to call us here at PHA if you have insurance questions. We may not be able to solve all your problems like Caring Voice Coalition can, but we can certainly connect you to resources. And our contact information is up there on the screen. And I also wanted to thank Miranda, Amy, and Lois for all providing so much information and so much wonderful and really valuable information today. So thank you guys all for being on the phone. And McCall, did you want to add anything else?
I did, just a few very short closing things. I wanted to thank everyone. I wanted to thank Miranda and Amy and Lois for presenting, and also to thank all of you who have participated in the call. I'm so glad that you could join us, and I hope that you'll join us again, because the call happens every month on the third Thursday of the month, and we have different topics every time. And again, you can check that schedule anytime by going to the PHA website, so it's phassociation.org/parents. And I think that is all that I have.
Great.
So,
well, thank you for having us. It was our pleasure to be here, and hopefully we provided some, you know, valuable information.
Thank you guys.
Thank you very much. It was helpful.
Thank you.
Thank you. Good night.
Good night.
Good night.
Right.